Welcome to PATHTalks. This is Lisa Thomson, Chief Strategy Officer for Pathway Health, and I will be your host for today's episode. Through this space, Pathway Health experts and other industry leaders will have an opportunity to share valuable insights that are focused on enhancing knowledge, sharing resources, and inspiring healthcare leaders along their career journey. Joining us today is Sue LaGrange, Chief Nursing Officer for Pathway Health. Welcome, Sue.
Hi, Lisa. I'm happy to be here today.
Well, we're happy to have you as well. And our topic for today for clinical leaders is the overall emergence of the Delta variants and how we respond as clinical leaders, knowing what is happening in our community, as well as the impact to our residents and staff. You know, Sue, there are many things that clinical leaders really need to consider as they respond to the reemergence of COVID-19 with this Delta variants. And however, I really want to know, what are your thoughts on what clinical leaders really need to consider as steps for risk mitigation?
Thank you, Lisa. Absolutely, that is a great question because this pandemic is really putting us through a roller coaster type of environment, right? We are now, unfortunately, on that upside. The data from national statistics show that even in the last 2 weeks, daily new cases have increased by approximately 100%. And daily deaths by over 65%. Our industry has really done a great job with reducing the caseload of our staff and residents. However, we need to be concerned with the Delta variant within our communities and with potential outbreaks within our facilities.
You know, Sue, that is really a great point that you brought up, the potential for new outbreaks in our facilities. So, with that being said, Sue, what strategies do you recommend that really these clinical leaders across the country should consider as this variant continues to spread so rapidly?
Well, Lisa, we've done so much staff training, but some strategies that leaders can continue to take is continue working with what we're doing with those core principles of infection, prevention, and control that CMS has outlined, such as screening, hand hygiene, masking, social or physical distancing of at least 6 feet, that good cleaning and disinfection, appropriate staff use of PPE continues to be a concern, proper cohorting, making sure we have good systems for standard and transmission-based precautions, including our COVID positive and our quarantine, as well as our testing for both staff and residents in accordance with the guidance. We also need to be looking at observations and ongoing coaching. Therefore, with that variant, that Delta variant spreading so rapidly, even with fully vaccinated individuals, and many of them, as everyone knows, are asymptomatic, and we couple in that with school starting within a month, it will be important today more than ever to protect our resident population with our staff.
You know, Sue, that is really a great reminder for all of us to reconsider and refocus our energies around the core infection control principles for COVID-19, reminding ourselves that these are very important principles in reducing that risk for the potential outbreak in our organizations. With that being said, Sue, if there's one thing that you think that a clinical leader should start now as they prepare for this potential emergence of the Delta variant, what would that be, Sue?
Well, Lisa, vaccination is going to continue to be that key mitigation strategy. Certainly vaccination for all, unless someone is medically contraindicated. And how do we reduce that vaccine hesitancy in our settings that we're seeing? There are many resources available to work with staff on vaccine confidence and really looking at, is your facility ready for the mandates if they have or are talking about them? We're also seeing state requirements now coming about for vaccination of staff, Lisa.
So you did talk about, the vaccine hesitancy, and that has been discussed in the national news. It's been discussed in a lot of our industry, documents that are coming out. And you also mentioned that there are a lot of resources out there. So are there national or other industry related resources that clinical, those leaders across the country that they can use, or any suggestions that you might have where they can look for those resources to help them as they're looking at vaccine hesitancy in their settings?
That's a great question, Lisa. People do not have to reinvent the wheel. There are great resources available. AHRQ, or the Agency for Healthcare Research and Quality, also has an excellent resource called Invest in Trust, a guide for building COVID-19 vaccine trust and increasing vaccination rates among CNAs. And that is downloadable. Also, IHI, or Institute for Healthcare Improvement, has a webpage blog that's entitled How to Earn COVID-19 Vaccine Confidence, Build Trust. In addition, state and national long-term care associations have a multitude of resources. State Department of Health websites also have some great resources. And the CDC has National Immunization Awareness Month right now until the end of August that provides tools and resources for healthcare professionals as well as for individuals. And very shortly, remember, we are going to be moving into that influenza season, which is another area we're going to need to have a solid, robust system in place.
Oh my gosh, Sue, influenza, how can we think about that in the midst of this, COVID emergence and what's going on in their settings? But really, influenza, that really sounds like a very good topic for another one of our Path Talks coming up. So, in the midst of all this, are there any other resources that you could recommend for clinical leaders?
Absolutely. Pathway Health has a multitude of resources that we have available as well. We have a quick path that provides leadership information, checklists, policies and procedures, and education with post-tests for vaccines, for COVID vaccines. But in addition to that, we have an infection prevention and control manual that has just been updated that provides information for the infection preventionists on general best practice approach, guidance, for as well as COVID-19. It's for the entire infection prevention and control program. And we also have manuals, toolkits, and quick paths. And also, I just want to end with Pathway Health has some complimentary downloads available on a multitude of COVID-19 areas that include policies and procedures, some leaders' guides, surveillance audits, and more.
And that is great. And I'm so glad that you talked about resources because, as clinical leaders, we have so much on our plates, and to not have to reinvent the wheel is fantastic. So thank you, Sue, for sharing all that information. And again, vaccine hesitancy is first and foremost in all of our minds here as we're looking at this reemergence of COVID-19 across the country. So if clinical leaders want to learn more about this information and how they can reach out to you, Sue, how would they get in touch with you?
I can be contacted at, I'm going to give you my email address, Susan, SUSAN .LaGrange, LAGRANGE, at pathwayhealth.com.
Well, thank you, Sue, for joining us today on Path Talks. Visit pathwayhealth.com to access valuable resources, educational opportunities, and more. And until next time, this is Lisa Thomson. Keep on your path to success.